And now joining us is Congresswoman Pramila Jayapal from Washington State. She's a Democrat who serves on the Budget Committee. It's good to have you with us. Thanks so much. We are less than 13 hours away from a shutdown now. What do you want to see from your Democratic colleagues in the Senate? Because they're the ones who have the ball in their court. They could be voting sometime later this afternoon.
That's right, Anna. We have a situation where Republicans control the House, the Senate, and the White House. And in the Senate, in the House, obviously, they can pass things with a simple majority, which is what they did, a very partisan bill. And now they have to go to the Senate, and they need 7 Democrats to be with them, which means that you have to negotiate. If you are the governing party, you have to govern. If you have all 3 chambers, the 2 chambers of Congress and the White House, you have to be able to govern and negotiate. And I think what Democrats have said very clearly is this is unprecedented. We have never had a situation where Republicans have, in a partisan way, stripped health care from 15 million Americans already and intend to do even more to raise premiums and the price of health care, combined with the fact that when we have passed an agreement, as we did back in March, 3 months later, they came and rescinded the money that they had agreed to. Even Steve Womack, who's a Republican in the House, said, why would Democrats negotiate when there's no clear commitment from Republicans, from Russ Vought, that he's not going to strip away the money that we appropriate. So I think this is very important. Democrats have been very united. Hakeem Jeffries just did an amazing job, along with very powerful stories of people across the country who are dealing with these health care cuts that they've already seen and the ones that are going to come. So Democrats are clear. We're going to stand up. We want to cancel the cuts. We want to make sure that there aren't additional health care costs, and we want to lower health care so that it is affordable for all Americans.
We're keeping our eye on the debate happening there in the Senate. Meantime, Speaker Johnson spoke about the prospect of a shutdown this morning, and he once again said this is a clean, continuing resolution to keep the government open. Here's more of what he said.
It is a simple measure to keep the government open so that we can continue the appropriations process. It's done in good faith. And I will say this, Joe, it's exactly what Democrats all voted for 13 times during the Biden administration. Now they don't want to do it because they want to fight Trump. And a lot of good people are going to be hurt because of this.
He's trying to put this on the Democrats, who he says would be responsible for the hurt caused by a shutdown. Your reaction?
Well, of course he's trying to do that because he knows damn well that their health care cuts are incredibly unpopular across the country, that people will blame the governing party, and that at the end of the day, it's not like before at all, Anna. When we voted for continuing resolutions under Democrats, we kept our word. We made authorization decisions and budget decisions, and we didn't rescind on a partisan basis all the money that we had just appropriated. That's what they're doing. And to be clear, they have already decimated federal agencies. They've already fired 150,000 federal workers without any approval from us in Congress. And that is, I think they're going to continue to do that, decimate federal agencies and skewer the very things that keep costs down for Americans and allow Americans to thrive.
Just on this idea of it being a clean CR, they aren't asking for Democrats to sign on to any kind of specific policy agenda item, right? Why not support extending the funding for now to keep the government open so negotiations can continue?
Well, it's actually not a clean CR. This is a really important point. It's a little wonky, but I'm going to say it anyway. In the last time we did this, which, by the way, we're voting on a budget from last year, right? We have kicked the can down the road multiple times. But when we did this in the spring, it was a partisan bill that slashed a number of agencies. That is why no Democrats in the House voted for it. And at the time, they were able to get a couple, enough Democrats in the Senate. I knew that what was going to happen was going to happen. But they did get some people in the Senate to do it. Then they went ahead and passed additional rescissions packages and their big bad betrayal bill. So again, we're in a completely different situation, but this is not a clean CR. This continues funding levels that they slashed in March already from what was before. So this is a much lower, continuing resolution means you keep funding at the same levels as the last year. They've already violated that. So it's not a clean CR, it's a partisan continuing resolution. And we have to really stand up and say to Americans, we understand the pain that you're in, and we're going to fight to get your health care back.
Congresswoman, I want to read for you what is now appearing on the official HUD website this morning. This apparent warning, and I quote, "The radical left are going to shut down the government and inflict massive pain on the American people unless they get their $1.5 trillion wish list of demands. The Trump administration wants to keep the government open for the American people." Again, this is on the official U.S. government Housing and Urban Development website. What's your reaction to that?
Well, it's stunning, Anna. And if you look at the bigoted, outrageous, fake AI post that the President of the United States posted yesterday about our Democratic leaders, you get a sense of how out of control this administration is, these Republicans are, and it is exactly why we have to fight back. We can't allow them to continue to do this. They are abusing every executive power that has been given, and Republicans in Congress have to stand up and fight for their constituents. You know, I've got 14 rural hospitals in Washington state that are already slated to close. We heard testimony today from a mom with 2 kids that have autism, that how she is fighting and how the Medicaid cuts will make it impossible for her to take care of her kids. We heard from another man who's stage 4 cancer, who can't afford health care as it is. And it's just heartbreaking. And I think that the fact that Mike Johnson sent all the Republicans home should tell you everything you need to know. They don't believe in bipartisanship. They don't understand that they need some votes, at least in the Senate, if not in the House, to be able to do anything and govern. And so a shutdown is on them, Anna, but it is a travesty that this is what the White House is doing and how they're using their platform.
Congresswoman Pramila Jayapal, thank you very much for being with us.